Welcome back. Today we are speaking with Dr. Sam Siddighi. He is the Director of Female Pelvic Medicine, also Reconstructive Surgery here at the Loma Linda University Medical Center. We're talking about urinary incontinence and some of the different types of conditions that you treat. Mainly, is it with women?
I only treat women patients, and basically urinary incontinence is the condition where a patient will have leakage of urine, involuntary leakage of urine, and they'll have to wear a pad. So that's
quite common.
Very, very common. More than 30 million American women have this condition. Yeah. And the majority of the people who have this overactive bladder have urge incontinence, or the condition where they're leaking involuntary urine.
And that could be a problem, obviously, because you have to wear a pad, or if you don't have a pad, you could have embarrassing accidents, something nobody wants to obviously experience.
Basically, these women, the bladder takes control of their entire life. Everything revolves around the bladder.
Yeah. They can't go anywhere.
They can't go anywhere, or when they go somewhere, they have to know the location of the bathrooms. Yeah. They're not able to do the things that they enjoyed before.
What does the Loma Linda University Medical Center offer as far as treatments for this? Is it treatable?
It is a treatable condition, and certainly not a normal part of aging. And we have a female pelvic medicine and reconstructive center, a small center, in the Department of Gynecology. And basically, there are several treatments for this. The way I would start out with a patient is to tell her to do the easy things first, okay? And that is make sure that she avoids any bladder irritants. So
what are those?
Those are caffeine, caffeinated beverages, citrus fruits, acidic foods, green tea, coffee, chocolate. So those things should be avoided. Try not to overdo the amount of fluids they drink. Okay, so those are the basic things. I'd also have them take a look at the medications that they're taking. There are some medications like the blood pressure medications that can affect their bladder. And then do Kegel exercises. That's something that they can do at home, and they have to make sure they're doing it correctly. And if it's done correctly, just those three things can severely improve the urinary leakage.
Sometimes it does require surgery. What do people, or what can they expect after a surgery?
Right. So depending on what type of incontinence they have, the kind that we were just talking about is overactive bladder. There are surgeries for this. Before doing surgery, I would try some medications that can be effective. But if the medications fail, there's a surgery called a bladder pacemaker, or InterStim, that is very effective. There's also some injections that you can do in the bladder with Botox bladder injections.
Wow.
Yeah. Patients who have stress incontinence, that's a different kind of incontinence that we haven't talked about yet. That's the condition where if you've got a full bladder, you cough, sneeze, laugh, yell, anything where you're exerting yourself, you have leakage of urine. For that condition, there are very effective outpatient surgeries like the sling procedure.
And how does that work?
It's very technical to explain, but basically it's a 15 to 20 minute outpatient procedure where we make 3 small incisions in the vaginal area, and we place a support underneath the urethra, and the support acts like a hammock. And so when somebody is coughing, their urethra pushes up against the hammock and it closes.
Okay.
So during moments of laughter or coughing, their urethra closes.
So it's not something you have to live with. There's treatments, whether it's surgical or some of these other medications and other exercises that you can do. There are treatments.
Absolutely. This is not a normal part of aging, and we can treat this, and you just have to see the right doctor and get treated.
Okay. Now, interesting, you have a book. It's called What's Going On Down There that people can check out in the bookstores.
That's right.
And is that on Amazon? Can they find that anywhere?
They can find it on Amazon.com or BarnesandNoble.com.
Okay.
It's a highly recommended read. Dr. Oz recommends it.
So it's, and Dr. Oz, he knows what he's talking about as well. So that's a book, What's Going On Down There. Also, if you want to find out on the web some of the programs offered here at the Loma Linda University Medical Center, lomalindahealth.org. That's lomalindahealth.org. Dr. Sam Siddighi, thanks so much for joining us here today. Interesting information.
Thank you so much for having me.
Thank you. Top stories are coming up next. You're watching KESQ, the Desert's news leader.